Good afternoon, everyone. Thank you for the nice introduction. I work in food systems and nutrition, and I thought that this is a great platform, looking at the agenda of the Food Systems Summit, where we get to meet people working in environmental health, sustainability, food systems, agriculture, markets, and all. I think this is the place where a multi-sectoral subject like nutrition needs to be placed, and it is quite well placed if we are discussing this in a forum where I see the other groups are discussing about indigenous agriculture, low environmental footprints and stuffs like that. So the topic of this session is nutritional scenario in India, current status and way forward. But I thought we need to connect it to the macro level things, and that is where we talk about the food system. So a bit on food systems in India, which I think the other sessions have already discussed, but to connect why food systems and nutrition are so interconnected, and why we need to think, or we need to make all the fraternity, academia, nutrition literate. It makes a lot of sense, nutrition sensitive agriculture and all. So food systems in India, nutrition and food environment transition, which is happening in India, like I forgot your name. Manish was telling right now, and that transition actually is leading to the double burden of malnutrition in India. So kind of a justification of why it is important to study food systems with the nutrition lens, and of course the dietary patterns. We don't have so much of data, in fact, in terms of what India is eating right now. But yes, we have the DAB survey going on from National Institute of Nutrition, where we'll be able to get a fair idea about what we are eating currently. Why should policies and programs should look at life course approach to address nutrition, double duty actions, and creating an enabling environment. So I was asked to give an overview of this session. So I thought, let me take you through all these important aspects of why nutrition, understanding nutrition and food systems, and the other drivers of food system is very important. So I'll start with this figure, which you must have seen in the other sessions also, where we are talking about food systems, which is like from farm to fork. That is what we are producing, what we are marketing, what we are sending to the people, what we are transporting, what we are importing from outside. All these have a bearing on the last box, which is what we are finally consuming. The consumer behavior translates what is available around us in the environment to our dietary intake, and that dietary intake is translated into nutritional status, which we will be discussing at length in this session. But in India, what we are seeing is a transitioning food system. What does that mean? So if we go back to 1960s, we had Green Revolution. We had to feed a huge population, we had to be self-sufficient, so that was the right thing to do. But while doing so, what we did was we somewhere compromised on the diversity of grains that we had in our country, and we sort of resorted to, I won't say quick fixes, but something which was very important at that point of time, to feed the people. And to feed them, we relied on only specific kinds of food grains, increased their productivity. And we also focused on specific regions, high intense resource regions, who started producing a lot of food. But while doing so, did we compromise on the environment also? Perhaps yes. We did use a lot of artificial fertilizers, hybrid varieties, and somewhere the huge number of land races and the other gene pool of several cereals and pulses and other things which the country had somewhere got compromised, or we actually lost a lot of variety. And that is a global feature. It's not only India, it's a global thing which has happened. The number of species has really, the species richness has really decreased. So while doing so, we shifted. The modern methods of agriculture was very important. It happened, but it was only limited to some of the privileged large farmers. And what happened to the subsistence farmers? They still continued to grow in their traditional ways. So one way, the positive side of it is that we still have those methods available in some of the communities all across India, wherein we can learn. And I just saw there was another session on indigenous multi-cropping and farming, which happened. So there is a shift, but the shift is important. Technological advances are important, but it has to reach to those who need to produce more. And my next slide was on, in the interest of time, let's continue. So, and what happens to the processing and retail industry? Well, we are the largest producers. As again, Manish said, that we are producing a lot. We are, I have written some figures like we are 15% with an annual growth of around 15%. India's food retail industry is ranked as the 6th largest in the world. It contributes to a substantial part of the overall economic output and has grown because of favorable changes in the demographics. So the purchasing power has increased. The people in the middle income group are able to afford everything. And thanks to multimedia and apps and all, we are eating all wrong kinds of food at a cheaper cost. So, you know, Swiggies and Zomatos and all are making us eat all kinds of wrong foods and making us unhealthy, because now we are facing the dual burden of malnutrition. That is, we are still struggling with undernutrition, undernourished children. Look at the last NFHS 5 report. We have not progressed well. And on the same time, we are the diabetes capital of the world, and we have high levels of overweight, obesity. Look at the CNNS data. So, and look at the food systems in India in terms of prices. Because of the market dependence, the price volatility has increased, and we are seeing something which is called a protein inflation, wherein the protein-rich foods are expensive, unaffordable. And what is affordable is energy-dense, sugar-rich foods, high-fat, high-salt, and high-sugar foods, which are easily accessible, available. And again, thanks to marketing and other things which are making these foods more accessible, because they are non-perishable. They can be kept for years, whereas we, being the second largest producers of fruits and vegetables, are not able to give enough fruits and vegetables to our people because of the perishability part. So the technology is important. Technology is important to make fresh foods available to people rather than marketing packaged food and making them colorful packages, making or selling the colorful packages to the children of the country. And this figure is from the Euromonitor, which shows India as the large orange dot on the left-hand side, wherein the industrially processed foods, the ultra-processed food in global food supplies has increased, and in India it is a phenomenal increase of 8%. So yes, we are living in a food environment where we cannot afford to buy apples and oranges and other things, but we can definitely buy a 5 rupees pack and be happy, because these are aspirational food also. The transitioning food system in India or globally is that we all started with a traditional food system where we were producing natural food, accessing natural food environment, but the level of infectious diseases and all and mortality were higher. Then we transitioned to the mixed food system, wherein the markets play a very important role, and globalization and urbanization makes us access different kinds of foods and foods which are perhaps not so healthy. And finally, we want to reach the modern food system, which is a nice mix of a generation which is sensitive towards their health. They go do workout, they have enabling built environment to walk around, and you see the Scandinavian countries, how they are back to cycling, and we are buying BMWs in the country. So yeah, that is what we want to do in later part, or perhaps we need to leapfrog the middle part. That also, according to Dr. Barry Popkin, is important, that these are the different patterns of food systems and nutrition transition which happens, where we start with hunter-gatherers and then we move on to a period where we start growing food and we rely more on cultivated food environment, but then there is shortage, and because of shortage there is famine, and then we have our policies and programs and interventions which lead to receding famine, and then there is increase in chronic diseases, and finally we reach stage 5 where there is behavior change and we rely on more physical activity, less sedentarism, eating more of traditional foods and all. So is this transition inevitable? Perhaps not. So if we say that, yes, we have to go through that high level of undernutrition and overnutrition, and then only we can transition to pattern 5, perhaps not. with sensitive interventions and all, we might leapfrog stage 4 and directly go into stage 5, where you have a mix of good things. You learn from the West and may not follow what they have gone through through the different phases of nutrition transition. And as I can see, what is happening right now is increasing vulnerability to nutrition transition in our country because of the complex scenario of coexistence of multiple patterns of nutrition transition within the country. So you go to an urban food environment and you see supermarkets and hypermarkets and people are just ordering online, whereas you go to the tribal communities where you see that people still have to walk kilometers to get basic amenities of life. So we are seeing the two extremes, but we are also seeing a lot of transition happening in the rural environment because of promotional activities and activities of promoting wrong kinds of food and bringing them to the reach of those people who actually can survive well with their traditional food purchased from their traditional markets. So somewhere we have to intervene at the market level and make markets more traditional. We can't say a tribal to just go to the forest and grow their own food and eat. Everybody is developing, so do they. But then they can actually access their markets to get healthier foods and reduce the opportunity cost of consuming a traditional diet. The diets in India, as we all may know, it's still predominantly cereal-based diet, and though there has been a decrease in the consumption of cereals, but with food inflation and all, diversity has really gone down in the Indian food systems, be it urban or rural. Staple grain policies and all actually incentivize the farmers to grow diverse foods, and also our food policies, our agricultural policies should be nutrition sensitive, should talk about diversified food, promoting diversified food production. And if we see the food and nutrition policy landscape and diets in India, despite the regional disparity in consumption, cereals are consumed highest across the country. A rural-urban divide exists where the urban areas are better with dietary diversity, but also they are consuming all kinds of wrong foods as well. And of course, lower consumption of vegetables and fruits, which leads to the double burden of malnutrition and the diet-related non-communicable diseases. If we look at the consumption pattern, this is somewhat old, 4 years old report, wherein if we see what is the recommended total energy from cereals and pulses, we are consuming more of cereals and pulses. But look at the rest, 6.1% of the total amount of pulses and legumes we are consuming. We are consuming grossly lesser amount of vegetables and fruits. So there is a disconnect between the largest producer versus the consumer. There is a total disconnect, and we need to, encash on our technological advances to make these fruits and vegetables available to our community, and of course have localized solutions. Making local foods popular is something we need to look for. And this is a very recent work which has been compiled by Niti Aayog and a group of economists, where they are seeing that the universal rise in the processed food consumption, but more amongst the people at the highest quintile. So the black box on the corner, you can see the last two bars are on packaged ultra-processed foods, and you can see between NSSO, the previous NSSO and this NSSO, there has been an increase in the consumption of the packaged market-based foods. So, and also with better technology, we can definitely see that foods are available. Seasonal foods are available all the year round, and fruits and vegetable availability has actually increased. This is also from the same report from Niti Aayog. Now, comes the consequences. And what are the consequences? As I said, the coexistence of undernutrition along with overweight, obesity, and diet-related non-communicable diseases with individuals, households, and populations all across life course are facing the challenges. So we can see in NFHS 5 shows, I'm going to share the figures, shows high level of stunting, wasting, underweight, diet-related non-communicable diseases, and their risk factors have also increased. And this is happening within the household. Within the family, we see both non-communicable diseases, communicable diseases, and undernutrition coexisting across stages of life cycle. And if we look at the figures now, 1 in 5 women are underweight. At the same time, 1 in 4 women are overweight and obese. 1 in 2 women are anemic. In men, we are seeing malnutrition, overweight and underweight, and 1 in 4 men are also anemic. Sorry. Then look at the blood sugar levels. Well, there is a gradient between urban and the rural, but as you can see, women and men all are showing high levels of blood sugar levels, elevated blood pressure levels. 1/5 of the population have elevated blood pressure levels. Nutritional outcomes in children: 1 in 3 children are stunted, 1 in 3 are underweight, 3 in 5 children are anemic, 1 in 5 children are wasted, and one of the reasons is what are they eating? Only 1 in 10 children in the age group of 6 to 23 months are receiving adequate diet according to a basic criteria given by WHO. And we are seeing somewhat dual burden of malnutrition in children also. So we see stunting, and along with stunting, overweight exists at some stages of life cycle in the children. Children 5 to 9 years have double burden of stunting and overweight, and so are adolescents. Risk factors of non-communicable diseases are there in 1 in 10 children and adolescents are pre-diabetics, 1% of the children and adolescents are diabetic, 7% have risk factors of chronic kidney disease, and 5% of adolescents have hypertension. So the figures are alarming, but yes, we must now take cognizance of the fact that we have to address double burden of malnutrition. Again, another data is showing that 50% of all kinds of morbidity and mortality in children can be accounted or can be attributed to malnutrition. And why is it important that we should have a life course approach to address malnutrition? Because nutrition has an intergenerational effect. So if you start with a malnourished mother who is he is not able to give good fetal nutrition to the baby when the baby is in womb, the baby is likely to be malnourished, who grows up to be a malnourished child because the food behavior and the practices are compromised throughout the life cycle, which then this child gets into adulthood and gets married early or is malnourished, is not able to take care of her own nutrition and is bearing a baby. So all the more reason that we have to look at the intergenerational cycle of malnutrition, and all our policies and programs should be directed towards that. And finally, we need to have policies and programs which are double duty. What does that mean? We need to include interventions, programs, and policies that have a potential to simultaneously reduce the risk and burden of malnutrition, that is both over and undernutrition. So the policies and programs should not be focusing only on feeding the child and giving him enough calories and proteins, but also preventing long-term malnourishment, overcorrection of malnutrition. All these are very critical. And why do we want the policymakers to focus on one platform? Because they have limited resources, both fiscal, human, and time. And identification of opportunities to achieve multiple goals and targets with single intervention is the key. And that is why we are focusing on double duty actions. So if you see overweight, obesity, undernutrition, and you give an intervention. So my next speakers are going to talk about ICDS programs, and we have the public distribution system. We need to think now, do we give sugar as a part of public distribution system, or maybe a pack of dal, or have, like in Rajasthan, we have these Poshan Kendras under the public distribution system where they're giving other nutritious foods as part of the package. A diversified food packet is important so that we give all the good nutrients and make the population nutrient secured. And this is my last slide. The 3 levels of doing double duty is: number 1, do no harm to the existing interventions in the name of double duty. So use the same platform to make it double duty. Retrofit the existing intervention to make them double duty. Think again of diversifying the food with the perspective that it has all the phytochemicals, vitamins, and minerals which will prevent chronic degenerative diseases in future. And de novo double duty actions, like think of newer interventions. And the policies and programs which my other speakers are going to discuss. But yeah, there are food sensitive programs which can be used as a platform of double duty action, and other nutrition sensitive programs, because there are causes of malnutrition which are beyond food and agriculture. There are underlying causes of nutrition and the basic causes of malnutrition, like the political and ideological frameworks, environmental safeguard, trade and patent, the trade policies, everything has to look into creating an enabling environment to prevent malnutrition in the country. Nutrition is a multi-sectoral problem with multi-sectoral solutions. So we need to look at agriculture, food security, health, social protection, water, gender and equity, and climate change if we want to make a holistic intervention to prevent malnutrition in the country. Thank you.